Shall we begin?
Yes, let's get started. So we want to introduce ourselves. We know that most of you know us, so you probably are tired of hearing us introducing ourselves, but not all of you know us. So I'm Dr. Janet Galipo, and I've been in private practice, Doctor of Oriental Medicine, for almost 30 years now. It's a long time. So amongst other things, I would say that I have treated many, many thousands of people over the last 30 years, both in person and remotely. And along with Dr. Laura, we have treated many hundreds of people who have COVID-19 and also many hundreds of people who decided to get the vaccination. And this is over the last year plus. So we feel, because we've had so much direct experience in this area, that we are in a unique position to give you an East-West perspective. It's kind of like from the trenches, right? Because it's not something that we're reading about, or anything associated with any political party or social movement. It's actually based on our treatments, our sessions with COVID folks and vaccine folks every day. So that's me.
And I know most of you, but again, I'm Dr. Laura Stuve, and I am a PhD molecular biologist by training. And so after 26 years doing basic research in human genetics and epigenetics, I transitioned into mind-body medicine. And I have been working with Dr. Janet for a while. We did a research study looking at the effectiveness of mind-body medicine, body talk, mind-body medicine for chronic pain several years ago. And now we have been collaborating on East-West solutions for the current healthcare crisis. And as Janet said, we're going to be sharing both things from our experience working directly in this area, as well as me being a scientist. I really keep tabs on the latest science of COVID-19 and the variant of the day, which is what we're going to talk about today, the Delta variant. And so I am going to be updating everyone on the latest science, and I hope that you all learn something that is helpful. So I want to say a little bit about, first from my perspective, the intent. Why are we doing this talk? Well, this is a rapidly changing landscape. The virus is changing itself. The strategies that are being used worldwide to address the virus, the vaccines, there's more and more vaccines, there's more and more information on both side effects and benefits of the vaccines. And so it takes a lot of time to stay up to date on all this information. And it's like one of my little current obsessions. So I'm going to share some highlights of that obsession with you. And really, it's to help everyone make the best decisions right now. This is a crazy time, and there is a lot of misinformation out there in different media forums that is making it hard for people to navigate. And this information and the kind of the two different poles of information is really dividing people. So people are excommunicating people that are either vaccinated or not vaccinated, or wearing masks or not wearing masks, and it's a very sad state of affairs. I think I'm personally disheartened by it. So as a scientist, I really want everyone to know these are the numbers. You can make your own decisions based on this information. So that is my goal, to really provide you with what I know from, as Janet said, our own work with a lot of people that have had COVID and the latest science to help figure things out. I want to say that I've seen that from the community of healthcare practitioners and students and colleagues that I've been part of now for over 15 years, many people have unsubscribed and sent me emails about how horrified they am with the stance that I am taking on COVID-19, that there really is no pandemic, that how could somebody in energy medicine possibly be saying the things that I'm saying about the pandemic or the vaccine. But again, I am both an energy medicine practitioner and a scientist. And I think that energy medicine and mind-body medicine is science-based. And it has always been my goal to science up this community because both practitioners need that and our clients need that, because we are really resources for information. So that is my intention.
Yeah, and I also think that, a lot of the different, comments that, we've gotten in this area have been from people who don't necessarily have direct experience of working with clients that are going through COVID-19, of working with people both in the hospitals, because we've done remote treatments on people who have been in the hospitals, intubated on oxygen, as well as people who are home, who are trying to recover and maybe having, all sorts of symptoms, including breathing difficulties. And then also what they call long COVID, now people who have had COVID and who are coming through it and are really having a hard time recovering in terms of, their energy and their lung recovery process. So we're very committed to working with people who are going through COVID on all levels. And many times what we've seen is that those people who are reluctant to talk about this or to engage really don't have a close relationship to what is going on. They don't have this hands-on relationship. And then as Laura says, on top of all of that, she is a scientist and she is really basing her recommendations on scientific data, not, commercial, media or anything like that. So anyway, so that's what we want to say to you today.
So Janet's going to share a little bit about what we've been up to since the beginning of the pandemic.
Yes. Well, everybody knows that we became aware that there was a pandemic last March. So it's been almost a year and a half. And although we are primarily dealing with chronic health conditions, when we work with our particular brand of energy medicine, we realized, wow, there's a global pandemic. This has the potential to get really serious, and we'd better, step up to the plate and educate ourselves as far as what we can do to help. So in that vein, we developed a lot of different protocols for dealing with COVID-19, both from an East and a West perspective. And so we had to, develop these for our own use for our clients, and also as part of a educational program that we were running, we wanted to provide tools for our students so that they too could work with their COVID clients. So to that end, we estimate that we have treated more than 500 people, either directly or through our students. It's probably the numbers are much greater than that, but we've sort of tracked about 500 case studies that either we've done ourselves or, as I mentioned, through a community program where we actually set up a kind of mini study where patients who had acute COVID were able to receive a group of treatments, either 3 sessions, or if they were still not feeling well after 3 sessions, another 3 sessions. And these were people with acute COVID as well as with a long hauler. As I said, some people were hospitalized during this time, other people were at home. And in addition to these one-on-one sessions, we also started a weekly community kind of group session that we called Immune Tune. It started March of 2020. and we were meeting weekly. People could join in, and everybody kind of got a weekly session to really work with their immune systems from both an East and West perspective. Then we began to hear about the development of the vaccine, and so that became available early this year. And people were very worried about the vaccine. And so Dr. Laura and I said, you know what, we think that we can develop an effective COVID-19 vaccine reset protocol that will prepare people, prepare their physical bodies, their cells for receiving the vaccine. And then also, you know, if they experience side effects, we'll also be able to address side effects after they have received the vaccine. So that is active. You can go on our website and sign up with any one of a number of practitioners. They are doing these vaccine reset sessions very, very effectively. And then kind of as an offshoot of that, of really trying to think about, you know, quick things that we could do in order to reset our systems, Dr. Laura and I developed the Elemental Reset program. That was recently. We've just been going with that for a couple of months now. And it's for everyone. And so it has 6 amazing techniques that work with both the kind of Eastern perspective on resetting the body, the meridians, the chi levels, as well as the Western perspective of working with the immune system and different areas of the body, you know, stress, inflammation, in order to quickly kind of reboot and reset the body. Yeah, so that's what we've been doing the last year or so. You can see we've been busy. So, you know, one of the things that I think it's important to remind ourselves is that this is not the first time that humankind has seen a pandemic, right? So it seems that there are lots of pandemics worldwide. There's usually at least one major one every 100 years or so. And as it says here, Chinese medicine has been effectively addressing this concept of infectious disease and pandemic for many thousands of years. And as it says in this quote, from the Western Han dynasty, rather, which started, you know, a long time ago, right, over 2,000 years ago, to the early 20th century, the Chinese estimate that there have been at least 321 large-scale plagues, and that's just in China. And so Chinese medicine is really uniquely geared towards dealing with this, serving what they call, you know, life and death battles against all of these different plagues, you know, regardless of what they were caused by, very consistently, you know, through time, through millennium. And they have successfully contained the spread of epidemics to a limited area and a limited time period. And so we address this. We want to use the wisdom of Chinese medicine in our work with COVID-19 and with the vaccine program. And then, of course, the modern science of the immune system, you know, our understanding of the role of the individual cells, you know, plus all of the latest science of COVID-19 have really helped to bring the best of both worlds into this vaccine program.
So I'm going to start into a discussion now of, you know, COVID-19 and the virus that causes COVID-19. And one of the angles that I'm going to take us on in this journey today is I want to convince everyone that we need immunity to this virus. And there's 2 ways to get it. You can get the, you know, the virus and the disease it causes, COVID-19, or you can get vaccinated against it. Those are the 2 ways to get immunity. And we will return to this question shortly. So the virus that causes COVID-19, the SARS-CoV-2 coronavirus, that's the virus name, and the disease it causes, we all know and love, COVID-19. It's caused by this little viral particle. We've all seen the images of it with all these little spikes on the outside, the spike protein. And the vaccines are all made against this protein offered up to the immune system in some form. If we were to split the virus open and look inside, this little wiggly line here is its genetic code. It's the information blueprint that makes a virus. And this is what mutates and changes, at a very low rate, but every time the virus divides and goes from one virus to two, there's an opportunity for changes in this code that produce variants. So the numbers as of yesterday, I know they're different today, but as of yesterday, these are the global numbers, 208 million cases worldwide of COVID-19 and 4.37 million deaths. These numbers are so big, we can't wrap our brains around them. And sometimes I think of things like, the recent earthquake in Haiti just a couple days ago, where 1,300 people have died, and we all see that number and we're horrified. But if we look at how many die in the United States every week from COVID, it's the same number. And cumulatively, these numbers are both known to be grossly underreported. This number is enormous. We cannot even fathom this. But what we can say in terms of evolution of this virus is that every time the virus infects a person, there are millions, billions of virus particles in that person, all undergoing division where this genetic code has an opportunity to change. And because there are so many cases, there are so many variants. And we will get to the variants in a minute. So this is my own personal graph that I made for just to convey what's going on with COVID-19. And this is the original, the Wuhan virus. It's not the current variant we're all dealing with, and we'll talk about that in a minute. So if we look at the percentage of, the different percentages in terms of the types of symptoms people get when they get COVID-19, about a third of people don't have any symptoms at all. They don't even know they're sick. And depending on what report you read, in some reports it's 25%, in some reports it's 60% have no symptoms, but the average across many different studies is about a third. Okay. The number of people that are so ill they end up in the hospital, that number is pretty firm at 12%. Okay, so this is quite a range. 12% of the people are hospitalized, and a third don't even know they're sick. And then everybody else, a little more than half, get either mild flu-like symptoms to pretty serious flu symptoms. So this is a very large percent of people that get infected that have very serious disease. And because a third of people don't even know they're sick, they're walking around doing a lot of spreading of the disease and continuing to create more people that end up in the hospital. So one of the unusual things about COVID-19 that we all know is symptoms persist. It's not like the flu in that you're sick for a week or sometimes two, but in 2 weeks you're better. 2/3 of people, if you go out 3 months to when all the, they were essentially recovered, they still have one symptom at least that they didn't have prior to COVID. And then there's a special class that we'll talk about in a moment, the long haulers that have COVID-19 for months. And these people are now called the long COVID cases. In addition to the persistence of symptoms, there are hidden health impacts that likely won't even be surfacing now, but in 5 years, in 10 years, will turn into more serious disease. So I think globally, we are going to be looking as healthcare practitioners at the repercussions of COVID-19 for years. We need skills to address this disease because it's going to be causing, chronic long-term inflammatory-based conditions in all of these people, these 208 million people. Even in some of the asymptomatic cases, there is lung damage and heart inflammation if you actually do scans to detect that. There are neurological impacts that are very common, very disturbing changes in the brain. And then the liver and the kidneys, these are all essential organs: your lungs, your heart, your brain, your liver, your kidneys. Damage in all of those areas from the disease, even in the people that don't get the long COVID. Okay, so COVID-19, the virus that causes COVID-19, is a virus that, unlike any that has ever before been seen, in that it infects so many different tissues. Most viruses are restricted and they go to the lungs, or they go to the gut, or they go to one tissue system in the body. SARS-CoV-2 goes to the lungs and to the lining of the lungs, the epithelium, the areas that exchange gas, the alveoli. It actually pokes holes in the epithelial membrane. We're used to leaky gut. It makes leaky lungs, which is a bad thing for lung function. It damages the heart and the blood vessels. Even in young, healthy people, it is causing heart attacks and strokes because of these cardiovascular impacts. Very serious impacts in the brain and the nervous system. For some people, it goes to their digestive system. It does amazing things in the immune system. It basically has the capacity to completely turn off the antiviral response so that the body doesn't even know that there's a virus attacking. And one of the main cells in the body that kills virus-infected cells is also turned off by COVID-19. And then unfortunately, in a lot of people, it causes this inflammatory rampage of cytokine storm. We know that loss of sense of smell and taste is a unique feature of this disease and very characteristic and diagnostic. And now I'm going to be talking from my own work at working with a lot of people that have had COVID-19, including family members, friends, clients, and people in these case study programs that we've been running. My background is epigenetics, which means changes down at the level of the DNA code, the code that determines when and where our genes are on and off. COVID-19 causes epigenetic damage, minimally in 5 genes, but on average, it's in about 10. Okay, for everyone that I've looked at, I have seen this. Everyone with COVID-19. Everyone has impacts on their immune system, essentially amplifying inflammation. And then whatever tissues were affected when they had COVID, whether it was the lungs, the gut, very commonly, there are also damage at the epigenetic level in those areas, and the brain is also common. Okay, so I'm an epigeneticist, and I know what this means, but to translate this in plain language, why do you care if COVID-19 causes epigenetic damage? Epigenetic is basically the mechanism of disease. So this means long-term health impacts that might be hidden now, but might show up in 5 years or 10 years, amplifying inflammation, causing chronic pain, chronic inflammation. Inflammation accelerates aging, and basically kidney damage, lung damage, brain damage. This is going to turn into chronic disease, in teens, in children, in people of all ages. This is the type of damage that is going to cause very serious health issues in the years to come. This is what you don't want when you have any illness. Okay, so let's talk about the long hauler symptoms. So this is the data from this month. From now, there's millions of people that have long COVID. About 10 to 30% of people with COVID-19 go on to develop long COVID. Those numbers are huge. Remember how many millions of people have COVID? That's a lot of millions of people that have this long-term symptoms. Coughing, shortness of breath, respiratory symptoms common, fatigue and exhaustion is very common, as are all kinds of areas of pain, muscle pain, joints, serious headaches. Something that I didn't realize until I looked at the latest information, there is sensory impairment, not just of taste and smell, but some people lose their hearing, and the inflammation in their eyes causes cataracts in very young people in their 20s and 30s, and they lose their vision. Insomnia, the neurological symptoms are varied and very disturbing. Lots of cognitive and memory impairment, but also delirium, confusion, psychosis, brain fog, cardiovascular issues, digestive issues, and then this cycle that I'm going to let Janet explain, which is, they're oh, I'm better, and then all of a sudden that they're back in the symptoms. This cycle of feeling better and then relapsing, which has a special name in Chinese medicine. And I'll just share couple more things here, and then I'll let Janet comment on that. So, and now there's enough people that have had long hauler symptoms that they have some data. So by 9 months, about 70% of people recover, but that means like a third of people are still sick with these symptoms, after 9 months. That's a very long time. And the best guess from the scientists and clinicians is this is an inflammatory reaction exacerbated by the virus. And I'm going to tell you what that is in terms of what I told you. That is the epigenetic damage of the immune system from the disease. That needs to be corrected and addressed. Okay, I'm going to turn it over to Dr. Janet.
Unmute myself. Yeah, so in treating long COVID, the things that we've seen, as Laura said, most frequently are very low energy, a lot of fatigue, people being unable to get back to their lives, their full-time lives, just a tremendous amount of exhaustion, and shortness of breath. Sometimes, even walking up a flight of stairs, where this was something that they didn't have before. And then, of course, the neurological symptoms, including brain fog, and just lots of, problems with, thinking and cognitive processing. So, and some days they feel like they're getting better. Oh, I'm finally feeling better. It's really been like 3 or 4 or 5 days now, and I'm feeling more clear. I really think I'm recovering. And then suddenly you're back in bed again, or they're back in bed again. Why is this happening? So this is a particular syndrome in Chinese medicine that we call the Xiaoyang syndrome, which is, they call it half interior, half exterior. And basically it means that the body really hasn't quite been able to push the virus out. And so damage, long-term damage from the virus is still happening in certain parts of the body. And there's really no way for the body to address it. So some days the body thinks it's getting better, but then other days it feels like it's losing the battle. And so that is one of the ways in which we've been able to address long COVID clients, is by understanding the ramifications of Xiaoyang syndrome and how to treat that. So yes, so we like to say that from the trenches, right, from the work that we've been doing, one client at a time, our observations are that COVID-19 definitely creates a lot of damage to the body, but that our energy medicine treatments really, really help to correct that, and that they help to really accelerate the recovery process. So as Laura quoted, for the average person who is having these recurring symptoms, long COVID, it may take them 9 months to really feel better and feel like they're finally over it. But if they receive sessions from us or our students, then that 9-month period is usually shortened to about 2 months. So we really feel like we have a unique ability to treat long COVID, the long haulers. And then, of course, as I mentioned in the beginning, we've had to treat a lot of acute COVID cases. Right now, for example, I'm treating 4 acute cases. So when I say acute, I'm actually talking about people who are hospitalized. So there are 4 people who are in ICU in the hospital. One of them I've been treating for a week. She's just been released. And then there's another one who is weaning off of oxygen. And then there's another one who's just been admitted into ICU. And then there's another one who's been in ICU in LA for several days. And even though he's not very old, unfortunately, he has some pre-existing condition. So he's having a little bit of a struggle. So we are, continuing to do these acute treatments as well as the long hauler sessions. And then, we were also concerned about the vaccination. What is this vaccine? What are going to be the long-term effects? Is it safe? How do we prepare people? Because, clearly, if we want this pandemic to be over, as Laura said, either you're going to get COVID in order to develop an immunity, or you're going to have the vaccine. I mean, basically, those are the 2 choices. So, we need to really consider how we can best prepare ourselves for the vaccinations. And so we've done hundreds of these prep sessions, and I don't think we've had anyone who's had any kind of a severe reaction. Laura, can you think of anyone? I don't think so. We've had people who've had some mild reactions that we've really been able to address, but I don't think there have been any severe reactions in all the clients that we've treated, as well as the clients that these students have treated.
Yeah, I think it depends on what you say is severe. There's pretty uncomfortable for a couple days versus I'll go through what kind of the National Institute of Health and the World Health Organization labels as severe in a little while, and we certainly haven't had anything in that level of categorization. So I want to talk about the variants now, just so that everyone understands what a variant is. So if we've got that many cases, hundreds of millions all over the globe, the virus in each person replicating many times, even though the rate at which the blueprint to make a virus changes is very, very low. If you've got so many replications, you will occasionally get viruses that are functional, that have slightly altered genetic codes and therefore slightly altered proteins. And if the outside of the virus, namely the little spike, is different, since all the vaccines focus on the spike, you can impact and lower the effectiveness of a vaccine at protecting somebody from COVID disease. So a variant will have a different genetic code. Often they have new properties. They have different physiology. They have different infectious properties, and they also compete with each other. So there used to be several variants, the alpha, the beta, the gamma, the lambda, but Delta has won the current race, and it is now the global dominant strain. And the rate at which it did that is pretty shocking. So just to orient you, that they adopted a Greek letter code instead of naming the viruses by where they're from. The original virus is the one that originated in Wuhan, China. The Alpha variant, which there's a lot of characterization of, we have a lot of numbers on how infectious it is, how easily it's spread. That originated or was first observed in the UK. And then the Delta variant is the one that caused the very serious COVID wave in India a few months ago. In the US, it has taken 2 months for Delta to become the dominant variant. On June 1st, 3% of the infections in the US were Delta. And 2 months later, on July 30th, 93.4% were Delta. And it's a different virus, which is why the Centers for Disease Control has changed all the things that they said about COVID. We're facing a different beast right now. And so we need different public health measures. We need different guidance. And that's something that a lot of people haven't been able to wrap their brains around, the difference. So I'm just gonna take you through that. And this quote from an article a couple days ago in the Washington Post, I thought was compelling. The rapid ascendancy to total domination is the real world proof that this variant, the Delta variant, is different. Okay, so what do we know about how different is Delta from the original SARS-CoV-2? It still is a SARS-CoV-2 virus. It's just got a few different letters in its genetic code that are different. And I'm going to pull out 3 differences here. One is how transmissible it is, which means if you've got one person with the virus, on average, how many other people do they give the disease to? So, for example, the flu, each person with the flu on average gives the flu to 2 other people. And then the most infectious virus that has been characterized is chickenpox, where each person with chickenpox gives chickenpox to 9 or 10 other people. So the original virus, the one originating from China, was just a little more infectious than the flu. So each person on average gave COVID to 2.5 other people. The Delta variant is quite a bit more infectious. It's not quite the same as chickenpox, but it's significantly more infectious than the original virus. So every person with Delta gives the virus to infect 6 or 7 other people. So I just want to show you how this plays out in terms of the math, so you can see the difference between 2.5 and 6, which doesn't seem that big a deal, is a big deal. So you've got one person, okay, they infect 2.5 people or 6 people who each infect that number and then again. So 3 rounds of infection. For the original virus, 27 people would have COVID, but for the Delta variant, 216 people would have COVID. So that's a big difference. And then if you take it out one more round, for the original virus, 81 people would have COVID, but for the Delta variant, 1,400 people. Okay, so that's why Delta is spreading like wildfire through people that are vulnerable. Okay, why is that? So for the original virus, the thinking was you could be in a closed space with someone for 15 minutes before you would get the virus. For the Delta variant, it's closer to 30 seconds. Okay, so just very casual, like checking out at the grocery store now is a potential exposure. Okay. And one of the other differences that is part of this transmissibility difference, people with, COVID-19 or any virus actually shed that virus. They breathe it out, they sneeze it out, and it's the viral particles in the air then that other people take up. So the viral load is the number of virus particles within a person. And the more the higher your viral load, the more severe your disease. There was a very strong correlation of that very early on in the pandemic. And amazingly, there is 1,000 times higher viral load with the Delta variant than with the original Wuhan SARS-CoV-2 virus. So that's a huge difference in the number of viral particles. Okay. The other thing, and that is still an open question, but it's pretty serious. Children have largely been protected from the previous variants and the original COVID-19 virus, but it doesn't appear to be the case for Delta. The symptoms may be significantly more severe in even quite young children with the Delta variant. ICUs are filling up with very sick children, unfortunately. Okay, so Delta is alarming. Are there more COVID variants that are going to be even more dangerous or perhaps less dangerous and, cause Delta to go away? Nobody knows. All of the experts say that this virus has surprised them at every turn. And so everyone's raising up their hands and saying, I have no idea. Okay, so the answer, who knows? But coronavirus scientist, this is Dr. Shi, I'm not going to butcher her last name here, but she is the Wuhan Institute of Virology's Batwoman. That is her nickname. She's the one that goes out and gets the coronaviruses out of the bat caves. The COVID virus has a very large genome, which means a large genetic code. And the virologists agree there's a lot more real estate for more variability to arise. So expect more variants. And the more people that are infected, the more likely the chance of variants. So it just makes the future a big question mark. All right, so we're going to return to this question. I have convinced myself from what I've read and what I have seen treating people with COVID or long COVID, that it is a very severe disease. You don't want this disease. And so how can you best get immunity? You can get it by having COVID-19 or by getting vaccinated. And we're going to discuss those options. Okay, and then we're going to answer all of these questions. Okay, so we've all heard this term, herd immunity, and I'm going to demystify it for you and tell you what it is and why it matters. Okay, why do you care what herd immunity is? Well, when we reach herd immunity for COVID, life goes back to normal. Okay, like it was almost moving into a couple months ago. Okay, we can wander around without masks, we can get on airplanes, we can visit people without worrying that we're going to kill them. Okay, we can be connected as we would like to be. And for those of us in this community, we can actually have in-person trainings or work with our clients face to face instead of on Zoom. We're very appreciative of Zoom, but there's other ways to work. So when we reach this magical point of herd immunity, and I'll go through this fantastic diagram in just a moment, the virus fades away. There is no one left to infect, or very few people that it goes down in representation and is a non-issue. Okay, so here we have in this blue crowd, all the people in blue are vulnerable. They are not immune. The red person is infected. So in this first scenario, this is a new virus. No one has seen it. This is March 2020, okay? Red infected person comes into blue community, people get it, okay? And the faster the red spreads, That's that transmissibility that we talked about for Delta is, 6 to 7 people for every person, every red person. Now, in the second scenario, we have some yellow people. The yellow people are immune, either because they've had COVID or because they've been vaccinated. So you've got some red people, but there's not enough yellow people. The red infection still spreads like wildfire. Okay. Here in the last scenario, we have enough yellow people that are immune that these red people, basically, there aren't enough people around to infect. And you can see there just isn't any spread. And eventually the virus will die out. So we probably have heard estimates like 70% of the population, which is why the goal was to get 70% of different, populations immunized. If 70% of the population is immune, we're at herd immunity, virus fades away, it's 2019 again, okay? Now with the Delta variant, because it's so infectious, the bar has gone up. We need almost everyone, 90% or more of the population to be a yellow person in order for things to fade away. So the Delta it's completely changed the game. It's made everything harder to get back to where we want to go. Okay. So let's go through the how to get to immunity. Option 1, 100 million people approximately. This was taken at a certain point in time, so who have had COVID, and then 167 million in the US that are fully vaccinated. Okay, so these people are at least somewhat immune. Well, first of all, how long does this immunity last? So the data suggests it's not too bad after you've had COVID. Immunity will last for about a year. Okay. However, we talked about there's the virus that was around a year ago, the virus that was around in May 2021, and the virus today. What if you had the original virus? What if you had COVID in 2020? Are you protected against Delta today? Protection is not very good. Okay, you get twice as much protection with vaccination as you do if you had COVID-19. So that's why the recommendation is, even if you have had COVID, you will have your protection against getting COVID again will be twice as strong if you also get vaccinated. So vaccination post-COVID gives a very strong boost to immunity. Okay, if you're vaccinated, the vaccines have been around for a shorter time than COVID, so we have a different window that we're looking at. The protection is very strong for 6 months, and then it gradually drops off. Okay, so Pfizer at 6 months, the immunity is strong, 83 to 91%, and Moderna is 94%, a little higher than Pfizer. Okay, so as of today was the day the Centers for Disease Control in the US decided that they are recommending boosters for everyone at 8 months, just to keep these numbers strong. Because, at 7 months, instead of 83 to 91, it's going to be about 81 to 89. And then another month later, it's just going to trickle down. And if Delta and, the next generation beyond Delta are around, you don't really want these numbers trickling down, or else it's more blue people. Okay. So now I'm going to get on my vaccine soapbox. So I am not like a strong proponent of vaccines. I am a mind-body medicine practitioner who does intuitive medicine. I do intuitive scanning. I tap on people's heads. I hold acupoints. I'm pretty out there in terms of all the scientists I know. They think I'm a lunatic. Okay, but I am a scientist, and I do not have a blanket opposition to a vaccine. Each vaccine is a distinct decision, okay, that I have weighed for myself, from my daughter, to recommend to family members, clients, other people who ask my opinion. So the flu vaccine, not a fan, never gotten the flu vaccine, can't imagine that I would get it. The research on the flu vaccine is tragic, okay? Wouldn't get that one. Whooping cough, did I want my daughter to have whooping cough? I saw a few kids with whooping cough. They were sick for 2 months. They missed 2 months of school, okay? I wouldn't want my daughter to get whooping cough, so I picked and chose what vaccine she got. All right, COVID-19, I would, I've read a lot about COVID-19. I've worked on a lot of people with COVID-19, and not a disease I would want. The long-term health impacts are bad. The vaccine is better in my, from what I have read. I got the vaccine. Okay, so that's how I weighed the decision. You have to look at the severity of the disease that the vaccine is preventing and the risk of getting the disease versus the adverse reactions from the vaccine. So you weigh what is worse. And I really believe from all the data that I've seen and the opinions that I've read that basically the choice for people now is, do you want the Delta variant of COVID-19 or do you want the vaccine? Because as I said, the Delta variant is spreading like wildfire. The chances are that almost everyone is going to get that if they are not otherwise immune. And you don't want COVID, in my mind. So I'm going to let Dr. Janet comment on her view of vaccines and the history of vaccines from Chinese medicine.
Let me unmute myself. So the idea behind really all illness, and particularly what we call exogenous disease, which is all disease that comes in from the outside, of which coronavirus is considered an exogenous disease, is to concentrate on disease prevention. And so this is an important part of Chinese medicine from the standpoint of not allowing the disease to penetrate into the interior areas of the body, because once the disease begins to affect the major organ systems, which of course in the case of COVID-19 it does, we know that it affects the lungs, it can affect the heart, it can affect the liver, it can affect certainly the kidneys. So it is affecting the major organ systems. It is penetrating in from, this sort of skin level, exogenous disease where, we're inhaling it, it's coming into our body and it's going to the inside and it's destroying the inside of the body, including the major organs. So the whole thrust of Chinese medicine really is on prevention. And the most important way that we can prevent ourselves from getting ill right now is, of course, by practicing, different safety measures, including, masking, etc. But as Laura says, the Delta variant is so very, very contagious, not quite as contagious as chickenpox, but it's, it's close, that it's everywhere and it's relentless. And so if we want to prevent ourselves from getting a deadly virus that could destroy our organ systems, I think that we are going to have to go in the direction of having what we can see is a relatively safe vaccination. And if there's concern about the safety of the vaccination, then there's a lot that we can do as holistic medical practitioners to really address these safety concerns. And part of that is really working with our vaccine protocol. Yeah, we decided to put this slide in because, as I mentioned, China's been dealing with pandemics for a long time, epidemics, pandemics. And so the concept of vaccination has been around for a long time in Chinese medicine. And so there's a great quote here. In 1796, English physician Edward Jenner developed a vaccine for smallpox, But 1,000 years earlier, practitioners in China and in Tibet collected pus from smallpox lesions and blew it through a straw into people's noses to help them develop immunity to the disease. So, I guess what we're saying here is if this concept of immunity, has been of developing immunity to deadly diseases has been so important for so many thousands of years, then clearly now we should be able to take advantage of what appears to be some relatively safe vaccination protocols.
Okay, so I'm trying to answer all the questions that are coming in, but we'll get to them after we finish. We just have a few more things to share here. So basically, this is, the summary of the numbers. And again, this is 12% chance of hospitalization. That was with the original variant. In the Delta variant era, there's, the people in the ICUs that are getting hospitalized are much younger, 20s, 30s, and 40s, because most of at least in the US, most of the people 65 and over are vaccinated. 10 to 30% chance of long COVID, serious symptoms for months. And my observations of the epigenetic changes that happened with COVID-19 are going to be promoting chronic disease and an increase in inflammation, pain, for years, if you get this disease. Now, the vaccine, we're going to go through the severe side effects and the common side effects. The rate of severe side effects is very, very low. And I have looked in hundreds of people that have gotten the vaccine. I know many people are worried about, these vaccines are untested. They could have long-term effects. It's possible they could, but if they were going to, that would be, they would have epigenetic changes now if they were going to have long-term effects. And I have not seen that in one person. And again, I didn't go in with a bias. I don't care whether they're there or not. I evaluated for myself to make this decision. Lots of serious changes down at the genetic level that are going to cause chronic disease currently or in the future. And I haven't seen that here. For a lot of people, it's a couple days that aren't very fun, but the vaccine is gone quickly from your body. It's not something that hangs out for weeks or months or years. It's like flashes through and triggers this massive immune reaction. Okay, so there are common side effects. Almost everybody gets a sore arm at the site of injection, mild flu-like symptoms, fatigue, headache, achiness, dizziness for 1 to 2 days are common with all the vaccines. They're less common with the traditional vaccines than the RNA vaccines. This is one of the things that we address with our vaccine reset protocol, calming down the side effects while boosting the immunity. There's 2 points of focus. We want a strong immune response to the spike protein and a diminished side effects. So the benefits, and I'm going to go through, I know many of you are talking about the Israel study in the comments, the immunity to COVID and protection from hospitalization. So in some areas, 99% of the people that are hospitalized are unvaccinated. In other areas, it's 96, but less than 5% of the people in the hospital now are vaccinated. So there is protection from serious disease. The numbers as of today, and this is symptomatic COVID, and then this is primarily not, it includes Delta, but it's a lot of data before Delta. So this is all of 2017 through August 17th today. There are 194,204 people that got vaccinated that also got COVID. That's out of 136 million vaccinated. So that's They know they had COVID because they had symptoms and they went and got tested. So that's 0.14%. That's a very small breakthrough infection rate. Now that differs from the numbers in the Israel study where there was that 42% rate of infection with Delta for the Pfizer vaccine. That is pretty, oh my God, the Pfizer vaccine is only 42% effective. Those are asymptomatic infections and symptomatic. So it's both together. It's that third of the people that don't even know they have COVID pooled in here. So Delta is changing the game, okay? These vaccines were developed pre-Delta. They are making newer versions that will have the Delta variant in there, but they're not here yet. And Moderna right now is offering better protection overall with Delta than Pfizer, which is why the Moderna stock went up. They do a great job of protecting you from the most serious COVID-19 consequences, which is dying from this infection. And people that are immunized can get long COVID. It is less prevalent, it's less common, the symptoms are milder, and in almost everyone, it's resolved by 6 weeks versus 9 months. So it's much shorter and milder. Okay, so those are the benefits, and these are the best numbers that I could find today. And yes, this is what the number looks like for all infections, symptomatic and asymptomatic with Pfizer and Delta. Okay. Okay, this is an interesting story that I think can inform how we work with the vaccine reset technique in the future. And it's going to show you where the vaccine development is going to evolve. And this is why are there breakthrough COVID-19 infections in the vaccinated? It's primarily because of this crazy Delta variant, 1,000 times higher viral load. That's a lot of virus, even through casual contact, some people not wearing a mask, right, or not wearing a mask. You breathe it in through your nose and mouth, and before you can get antibody neutralization, the antibodies flowing through your bloodstream, if you're vaccinated, the virus causes an infection. Okay, why is this? Okay, you're protected against severe disease because you have also T cells that are neutralizing for COVID, and you have these IgG antibodies in your bloodstream that if you're vaccinated, that will protect you against severe disease. Okay, the information is when you breathe things through your nose and mouth, they come through the mucous membranes. There is a different type of antibody that works in this area of the body versus the rest of the body, and it's an IgA antibody. And if you put a vaccine in somebody's arm, they don't develop an IgA antibody. They develop an IgG antibody. So there will be vaccines in the future that we will inhale through our mucous membranes that will also build this response in addition to the T cell and the IgG antibody response that will be fully protective. And the original variant didn't break through so much because you weren't breathing so much of it in. You weren't breathing in 1,000 times more virus. It was a very low amount. It's this whole viral load. But I just want to point out that this anti-COVID T cell and antibody response is exactly what we're focusing on in our vaccine reset to boost immunity. All right. Okay. Side effects. Okay. Serious adverse reactions. 600. The thing about these vaccinations, they might not have been tested for a long time, but they've been tested in millions and millions of people. So we have a lot of data. Okay. That's how we know that they're safe. 640 people with serious adverse reactions out of 13.7 million. Okay, anaphylaxis happens in 4 to 5 people out of every million vaccinated. heart inflammation happens in about a little less than 2 people per million and resolves within a couple weeks. Blood clotting is a little alarming, but it's better with vaccination than it is with COVID. So the AstraZeneca vaccine has the highest rate of blood clotting, although some data show that Pfizer might be the same. So 8 people per million doses with the AstraZeneca vaccine. So there's basically a slight normal risk of blood clots, up a little bit if you've had these vaccines, but the risk of blood clots if you have COVID is 8 times higher than if you're vaccinated. So vaccination is safer than getting COVID in the blood clot department. Okay. Which vaccine? Some people like the classical vaccines because those have been around for a while, and there are decades of data showing they work and they're relatively safe. Here you're getting the COVID spike protein in the background of a neutralized virus, like a cold virus. They do have lower rates of side effects, and their effectiveness is not as strong, which is why all the efficacy numbers on breakthrough numbers, you rarely see data on J&J and AstraZeneca. They report the best players, which are Pfizer and Moderna. These are the new technology, the RNA vaccines. So I looked at all the data in the US. We can get either Pfizer, Moderna, or J&J. I opted for one of the new vaccines because I wanted the higher efficacy. They do have a stronger immune response, more common side effects that aren't very fun, which I did have. And here you're basically getting the blueprint to make the spike protein in a little ball of fat. Then your body makes a bunch of spike protein, you develop an immune response to that, and pretty good effectiveness. We've gone through the effectiveness numbers. The other thing about this technology is basically it takes 6 weeks to update a vaccine with a new variant. So it can keep up with the craziness of something like Delta. I'm not going to discuss the other vaccines that are in the pipeline that some of you have asked about, but I got several emails asking me to address ivermectin for COVID-19 prevention and treatment. So I've done a summary of the research in this area. Basically, if you're a cow and you've got a parasite, it's your drug, okay? It's popular in groups of people that aren't comfortable with the vaccine, but from the reports, the big study that was just published with this came out last week, and it demonstrated no benefit of ivermectin for COVID. And I'll take you through the research history in just a minute. So this is an anti-parasitic drug that is primarily used in veterinary science on horses and cows. It's sometimes used for human parasitic infections, crazy parasites in Africa and scabies, things like that. It's not an antiviral. And it has very high toxicity if you overdose, okay, with serious health consequences and neurological effects. And this is something that you have to take every day. So why would you want to take something that is toxic every day versus a one-time or a two-time vaccine? It's, less weird stuff in your body doing a vaccine. So there was a preprint, which means not a full publication, but a preliminary publication in 2020 that has now been withdrawn. That was the main paper that showed the effectiveness of ivermectin. It reported a 90% reduction in COVID deaths in people that took it, but it had a very high level that would be considered toxic dosing used. The publication has since been withdrawn. Whole parts of it turned out to be plagiarized from other papers, and there were data irregularities. Some of the patient's data was duplicated and in there several times. There were also weird things like patients who died before the study started, whose data was in there. And so that paper is now considered not invalid. There was another paper later last year that had very small sample sizes, looked encouraging, but the journal withdrew it because the data quality was also poor. Okay, and these are like dozens of people. The first large-scale published study was on August 6th, last week, of 1,500 people. So this is enough people to really get some numbers. It's not as high as like 136 million vaccinated people where we have good numbers on the vaccine, but 1,500 people is enough to do good statistics. And in this study, there were no effect of ivermectin for COVID-19, mitigation of COVID-19 symptoms. So right now, there isn't compelling evidence that ivermectin is effective, and it is toxic. So I'm going to turn it over to Janet to describe kind of our body intuitive support solutions. And we have 36 questions to answer. So we will.
That's going to take us a little bit of time. Okay. Right. So we kind of went over some of this in the beginning. Okay. What are we doing about these concerns that people have regarding the vaccine? So Laura and I put our two heads together and we developed a vaccine preparation protocol. And so basically the way that it works is that a day or two before you are scheduled to have your vaccination, a practitioner tunes in and finds out specifically what needs to happen in order to balance you. The East protocol and West are pretty standardized. There's a little bit of information we have to find out by kind of tuning into your particular body, but they're pretty standardized. And basically, they're getting your body ready to receive the vaccine. So you get your first dose, and then a few days afterwards, the practitioner tunes back in to see what is going on. Of course, if there's any kind of a reaction, discomfort, then you get in touch with your practitioner. Practitioner tunes in immediately and is able to address what's happening. The idea here is that we want to optimize your immunity and minimize side effects. And I would say that we've done a very good job. These East-West protocols are short. They only take like 5 minutes. You don't have to be online. The practitioner tunes in, does the session, kind of, sends you notice that they've done the session. If you're having a vaccine that has 2 doses, they do a before and after with each dose. If it's only a 1 doser, then they do a before and after with each of them. And we also have been called in to do sessions for people who have been vaccinated, who have not had these preps and have experienced some unpleasant side effects. And we have been able to go in and quickly address the side effects from their vaccinations, even though they didn't let us know beforehand. So it's still very, very effective, even if you don't have the pre-vaccine protocol. Yeah. So what are we doing? Well, we are using acupoints for immune support. It says here qi and immune support, and some people wonder, well, what is the relationship between those things? Well, in Chinese medicine, your level of qi in your body and the circulation of qi in your 12 meridians is your immune system. Those things are identical. So when we say immune support, we are looking at your body's chi level. We're looking at, the chi of your organs. We're looking at the chi of your wei chi, your sort of protective surface level chi. We're evaluating that, and then these acupoints are introduced in order to provide maximum support for these systems. Then we look at, okay, so what are the possibilities here of somebody having a side effect? And this can be quite particular to the individual. And so maybe, their body just has a kind of over sickness response, perhaps based on prior experience with vaccinations. Like you're afraid, oh my God, here it comes. And oh, I had that, shingles vaccine, 5 years ago, and I felt horrible afterwards. I know I'm going to get sick this time. So we are able very specifically to identify this, go in and address that before it happens. Also, if people do have allergic responses to, medications, or if they've had an allergic response in the past to a vaccination, we are able to address that. Also, people who are prone to inflammation, a lot of us have, internal inflammatory conditions for various reasons. Maybe, there's diabetes, or, high blood pressure, or, different kinds of issues that would indicate internal inflammation. We are able to address that before the vaccine. So basically, we are supporting the person so that they have the right immune response, the strength of their immune response, the breadth of the comprehensive quality of the immune response. And in addition to that, we are doing some emotional clearing, because everybody, at this point, having struggled with this pandemic for 1.5 years, being so tired of it, seeing, most of us, so many people become ill from, pandemics or vaccine reactions, or, whatever it is, we have lots of emotions and lots of strong opinions about this. And we want to try to clear this because, we need to move on. We need to move forward with our lives and have some sense of, stability in the world. And so we do an emotional clearing as part of this.
All right, so I'm going to comment a little bit on this vaccine repair protocol and try to answer some of the questions. So a few of you are bringing up also the issue in female clients that have a very serious impact on their menstrual cycles from the Moderna and Pfizer vaccines. And I have worked with some of these people, and I think that there are things that we will add to this vaccine repair protocol in the future to deal with that side effect, because inflammation and female hormones definitely are intertwined. And Janet also has ideas about how to work with this issue from the perspective of Chinese medicine. So there are things that we can do this is a side effect, and an unpleasant one. And we, with our tools in the BodyIntuitive East-West Vaccine Repair, can bring things in to address that.
Yes.
So let's see.
I'm going to take a look at
there's a question, as part of this vaccine repair, Janet, do we recommend any also Chinese herbs to help balance things to deal with vaccination, or is it just energy work?
Well, we do just energy work with the vaccine protocol, and we think it's effective. For people who are interested in Chinese herbs, or for people who, for example, have had the vaccine without the benefit of the vaccine prep protocol that we provide, and are having some kind of a reaction, sometimes we will recommend Chinese herbs after the vaccine that will really help them to be able to process through anything that's happening.
Okay. And then there's also questions here about people that have different types of immune issues, CFS, fibromyalgia, what else have we got here that people have asked about? IgA deficiency, someone who's had cancer treatment and has a thymus that is not got a lot of activity. And so what to do about people like this that have a compromised immune system, either, facing the Delta variant or the vaccine. I've certainly worked with a few of these people, and I'm sure Janet has as well. Some people that need a session or two before they even get into the vaccine repair for general immune support and to address their specific immune imbalances before the vaccine. So, but with our intuitive assessments, we can determine who needs that extra focus before the vaccine and the vaccine prep sessions. Mm-hmm. So.
Yeah, if you go on the Body Intuitive website and you look at the vaccine prep sessions, there are a number of practitioners listed there, and you contact them directly. And these practitioners really are quite expert. And so if there are particular concerns, you're going to be able to write them, get in touch with them, of course, let them know what's going on with you, and they will be able to tune in and do an intuitive assessment to see if you need something other than the standard protocol. And it's been very effective.
All right. So I'm just going to say a little bit about this amazing spike protein here. This is a 3D image of it, obviously in cartoon form. And so this is the spike protein here, the yellow, the purple, the teal, the light blue. And variants are going to impact little nooks and crannies in this fabulous shape that is all over the outside of the virus. And so one of the things that we focus on in the vaccine reset is the breadth of response. People can make an antibody and a T cell response just to this nook and cranny, or they can basically make it to all different parts of the spike protein. So by focus, and as part of our intuitive focus, we can invite that broad immune response, and we can evaluate the breadth. And so in the protocol, we teach practitioners how to, bring in that, the strength of the antibody response, the strength of the T cell response, and the breadth of this response, which means seeing many different facets of this protein, because that is the variant protection. Okay. Okay. So these are, as we've been talking about, if you're a practitioner, you can learn the vaccine protocol if you haven't had it yet, or you can receive it if you're someone that wants to get a vaccine or a booster for your vaccine. And there's information on our website right here about that. We have a general set of stay healthy tools to support your immune system, lower your stress. Works from, again, this East-West perspective. We're next teaching it this Friday if you would like to join us. They're fabulous resets. I use them every day on myself and pretty much in every session I do. And then Janet and I are doing a pilot case study project on a small number of COVID-19 long haulers. We're going to apply for a larger grant to do a big study, and this is the pilot study to get ready for this. And we are going to, so if this is you, or if you know a long hauler that would be interested in this project, you can email us and we will get back to you with what that opportunity looks like. All right. And now we have 36 questions that I have not yet.
Okay.
Okay. And a lot of them are by one person who's put in about 10 questions and comments. And, there's some people that feel very strongly about their perspective, and I'm not really here to argue with you. I get emailed all the time, Laura, what do you think about the vaccines? What should I do? What should I do for myself, for my older, whatever parent or my, 10-year-old kid. And there's no way I can answer all those emails, but we can do a general talk and give, kind of our perspective in general. Okay. So what do you want to do with this pile of questions?
Well, should we start at the top and go down?
Sure. Okay. So Jess asked, what is the Elemental Reset course and what do we think about the booster shot?
Okay. Elemental Reset course is on Friday. Jess, if you can join us, that would be great. And as Laura said, with the booster, it seems like for right now that we may need a booster in 8 months after we've had a vaccination. So this is something that we may need for a little while. Gayatri says, on the premise that all health and healing crises arises as part of personal growth and perspective. Philosophical, how to train our focus on the pandemic and symptoms. Okay. Well, that's a big question. I'm not sure that I agree that all health and healing crisis arises as part of personal growth. I think personal growth is a consequence of getting sick, but in this situation we have something that is beyond our control. So that's one of the interesting things in Chinese medicine, where we talk about, causative factors behind disease. Part of the causative factors behind disease are choices that we make, right? About how we live our lives and how we eat and, all of these things, how much we drink and, but part of these things are beyond our control. So in this case, what we're saying is that we are in a pandemic, a worldwide health situation that is like beyond our control. And so what do we do about that? And, and at the same time, lots of people who are getting COVID also have pre-existing conditions, because most of us have pre-existing conditions. We talk about, they died because they had a pre-existing condition. Well, the truth of the matter is that most of us do have some kind of a pre-existing condition, whether it's, inflammation or, a cardiovascular issue or high blood pressure or diabetes or autoimmune or whatever. I mean, these things are very common. So, COVID, coronavirus, COVID-19 is coming into our bodies with these pre-existing conditions, and then the body has to address that. So that is why, first of all, we have to have specific protocols to deal with this, which we do with both COVID-19 and the vaccine reset. And at the same time, we need to be able to specify each session for each individual. And we are able to do that as well through intuitive scanning. So I think that's how we can address that. Cheryl is asking, what treatment do we have for people who still don't have their taste or smell back after 10 months? Cheryl, you need a couple body intuitive sessions, definitely. Yeah. So it means that, there's still, there was, some kind of neurological damage, and that needs to be addressed. Do the vaccines need to be updated with each variant to be effective? Well, clearly the Delta variant has changed the game. And I think that, there are, updates from the vaccine producers. What's the future? As Laura says, we don't know. We're just going to have to wait and see. Yeah, same answer. Will we need to get booster shots once a year forever? Well, we hope not. But, if it's going to take 90% of the population to develop herd immunity, we're just going to have to see how long that takes.
Yeah. And then Kathy asked about the booster shot, only a requirement in the US. It's not really a requirement. It just came out as kind of the assessment of the evidence. Literally that came out this morning. So different areas of the world are going to have their own scientific experts, make recommendations, but that is the recommendation du jour. And I certainly, I'm not looking forward to getting a booster. I did have a pretty serious, ugly 2 days, but I'm going to get one because I don't want COVID-19 Delta variant. That would not be my choice. Okay, so Julia asked, for those who have had COVID and still show as having antibodies, how will a vaccination to the original COVID offer protection to Delta? So the vaccines to the original COVID versus having the original COVID, the vaccines give more protection than the disease, which is interesting, but that is the observation. Yeah, you certainly could wait for a Delta specific booster. I know Moderna is working on that. I don't know about Pfizer. It just depends on timing. I don't know what the timing for a Delta booster versus a non-Delta booster will be. Okay, do you want to comment on the next question, Janet?
There is, okay, so Beta is saying there is a third way, is there not? That is keeping your immunity optimized with a range of tools and a mindset free of fear of the disease. I think that that is an option for an individual. I don't think that that is an option for millions of people who are in a global pandemic. I don't think that you can tell them that that is the way that we're going to deal with a global pandemic. Some people have a very unique situation in that they can stay very separate from others and they can work in a very unique way. And for that individual, that may be appropriate.
So Patricia says, are we recommending the booster or the third dose? I think that's, again, an individual decision. I'm going to go with the guidance that matches what I read. And as I said, I read every day on these numbers and kind of, I compare different reports. Well, this is what they found in the Israel study, and this is what they found here. How are these studies different? Which one can I trust? And so that's how I make my decisions. Yeah, but if immunity goes down, I will get a booster. Yeah. It's pretty hard to find data on the J&J. It does have a lower efficacy. Same thing with AstraZeneca. Okay. And then Natasha has a question here. How would we comment on inflammation of the heart in young adults 12 to 15?
Right, so that is a side effect that can occur. Usually it does clear within a few weeks, but we are recommending the pre-vaccine protocol in order to avoid a side effect like that. Okay, Kathy is saying, I personally know 5 people who have gone to the hospital and been in the ICU who've been vaccinated. Interesting. I don't know a single one. Okay. Mass vaccination, blah, 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 blah. Okay. Well, yeah, I mean, everybody has an opinion about that. But, as we've tried to express to you here, there is no perfect scenario. There are, concerns in every direction. But Laura and I, who've been kind of working with this very directly for 1.5 years, have recommendations and really feel like we've created a set of tools to help deal with a lot of these different situations. And so we want you to be able to take advantage of those.
Okay. All right. And then Brittany asked about where do you book if you want a vaccine reset yourself? And yes, even if you've already had one vaccine and had side effects for your second vaccine, you can sign up anytime. You just sign up at our website on the sessions page, I think. And then Jazz shares that she used to think it was okay grocery shopping in a KN95 mask and a shield. She's vaccinated for about 6 months now, but these days with the Delta virus, she wonders if she's okay inside a building where other people are not wearing masks. And I know you're in one of the areas that has a really high rate of infection. So, you're with that level of personal protection and immunity, you're probably okay in that scenario. But maybe if you have a 9-year-old kid who's not vaccinated, it wouldn't be a good place to bring them, sort of thing.
Yeah, that's a really good question, Jazz. I mean, that's a question that a lot of people are asking and wanting to understand. Some people are, double masking, and they feel, more protected in that way. So yeah, I think it just really depends on, your what strategy you want to follow. If you want to be extra protective when you go into a public place like a grocery store and you want to double mask, I think that's fine. And yeah, we have lots of comments here from Bieta. Okay, yeah, lots of comments. So yeah, so basically, we're trying to deal with as many considerations and eventualities as possible, both with COVID and with the vaccine. And as we started off by saying, we have worked either directly or indirectly on about 500 people. Some of these people have taken hydrochloroquine. Many of these people we've been able to observe, side effects. Some of these people have taken the ivermectin. Some of these people have taken nothing. Some of these people have taken Chinese herbs. Some of these people have experienced different side effects, both as a result of COVID and as a result of the vaccine. So we have done our best to try to address all of these different situations, both energetically, and then if other tools need to be brought in with other tools in order to do the very best for our clients. But we have done it really working on a one-to-one basis, not through reading articles about things that have happened.
Okay. So a few people are asking about our views of vaccines for kids. And basically, everyone needs to decide if they have children, what they recommend for their own kids. And so what I usually tell people is, this is what I, recommended for my daughter. She's 20. So, but if she were 10 and the vaccine became available, or if she were 13 and the vaccine was available, I would, I see what the Delta variant is doing to children, and I am concerned that the children who get COVID-19 now, Delta variant or not, that the epigenetic damage from the disease, they're going to have serious chronic health issues in their 20s and 30s. It's not going to be good. And so vaccination does not have that. Vaccination, in my mind, is safer. And so if my daughter were in that category of, younger than 20 and didn't make her own decision, I would have her vaccinated. That's the choice I would make for my family. Yeah. And if my child had all kinds of crazy immune things, I would find one of our amazing practitioners and have them get a set of sessions until their immune system really was ready for the vaccine. Yeah. Okay. And yes, we're going to make this this recording available to anyone that you want to share it with. It will be on our website. And there's questions about elemental reset. Will the practitioners recommend which vaccine to get? No, they don't do that. Do we think COVID will go away in our lifetime? I sure hope so. I don't want to get booster shots forever. But this is a collective problem. It depends on what the collective does. If we keep fighting over what is real and what is fake, it's going to go on a really long time, and it's not going to be good. All right. So Leslie asks about the small percentage of people that have a strong reaction to the vaccine. So I have developed a special set of protocols for this group of people. And I've also talked to Janet. We've got some ideas of east-west solutions for the people that get more serious inflammatory responses. And we train that now into people in the year-long program, but they're pretty sophisticated approaches. So we haven't woven that into the vaccine reset class yet, but there are practitioners that we can recommend that can prepare people with complications for the vaccine. Okay, all the information for Elemental Reset is on our website in terms of time. I think it's 10 or 11 Pacific, and it goes for 3 hours. And once you take Elemental Reset, it's only $61. It's worth a gazillion dollars. Every Tuesday, we have a half-hour refresh where we review one of the resets and we all do it together, and everybody loves those. And you can come to as many of those free of charge once you do Elemental Reset. So it puts you in an ongoing community. Yes. All right.
Have we answered enough questions yet?
Okay. Does your booster have to match the original vaccine? The experts say no. Okay. So Julia makes the comment, even though Jazz is vaccinated and wearing protection, it reduces the likelihood of her getting sick, but not necessarily for bringing the Delta variant home. Yeah, that's a pretty good point. Yep. Okay. Okay, so Lisa's trying to decide whether to cancel her trip to Iceland in the UK in October. Vaccinated 6 months ago, just too early for a booster. Yeah, I don't know. I just got back from Greece before everything melted down. So I'm glad that I got my vacation in before everything became a nightmare again. So there's some tough decisions we all need to make in many dimensions right now. All right. I think that's most of the questions. Do you see any others?
No, I think we've answered most of them. Some of them are a little bit repeat. So thank you very much, everyone, for joining us. We hope that this has been helpful. We think it has been. It's a lot of consolidated information that is really coming from, our expertise and our East-West approach to health and to working with COVID. And so we're very happy that you were able to be a part of it today. There will be a recording. And we really hope that we see you for Elemental Reset, because that really is one thing that you can do and that you can share with those around you that will really help to raise your immunity. And if you take Elemental Reset, you'll understand why the approaches there will actually raise your immunity. So we hope to see you there either Friday or I think it's September 23rd.
24th. Yep.
24th. And yeah, and it's been a pleasure. Thanks so much for being online with us.
Yes, and a few of you are saying you're registered for this Friday and you haven't gotten your Zoom link yet. That's because I just set it up and you'll be getting it later today. Okay. Yes. All right. Thank you so much.
Thank you.
For coming, for sharing us all your questions and engagement on this important issue. Yeah, we might not all agree, but it's important that we're talking and having conversations.
Exchanging information and sharing, and yes, all of it. All right. Thanks, everybody. See you next time.